sound good. How are you feeling about the surgery?
I'm just really nervous.
Are you nervous?
Yeah, I've never had surgery before.
Yeah, that's normal. Hopefully we'll talk to the doctor and see if we can get you something, okay?
Okay.
Hello, Ms. Lauer. My name is Dr. Wardle.
Hello.
I'm going to be doing your surgery today. I see you've met our beautiful nurse, Lisa. I was just going to get a report from her real quick and make sure that you're okay to get surgery, okay?
Okay.
Okay, so blood pressure 120 over 78, heart rate 66, temperature 98.6, and respiration's 18. She sounds clear, she sounds good. She's a little bit nervous, so if we can get her.
Yeah, I can order some Ativan for you, okay? All right, so I have the consent here for you, and you're going to sign this with Lisa in a moment, but I just want to double check. When was the last time that you ate?
Yesterday I ate dinner at like 7,
Okay, and when was the last time you drank anything?
maybe like 9. I had a cup of water.
Okay. All right, and then do you take any medications at home?
I don't.
Any multivitamins, anything herbal supplements?
Nope.
No? Okay. And then this is just double checking. I know you know why you're here and everything, and I'm sure this is
My sister.
sister. Okay, and she's okay to hear everything that I have to say?
Yep.
Okay. So we're going to do a laminectomy. We're going to do back surgery for you because physical therapy and other measures weren't working.
Okay.
It's your L3 and L4 according to the myelogram, correct? All right, and there's some risk associated with surgery, just like any other surgery. You're going to be worried about bleeding, cerebral spinal fluid leak. You're going to worry about infections and blood clots and possible nerve damage. We keep everything very sterile, so we're not too worried about infections. We're also going to give you an antibiotic to make sure that that doesn't happen. And then we're also going to give you a drug called Lovenox to prevent blood clots while you're in the hospital here, okay?
Okay.
And then the recovery should be pretty minimal as long as you keep working with us and do your physical therapy and things like that.
Okay.
Do you have any questions for me?
No, I'm just nervous.
Nervous?
Yeah.
Okay. Well, like I said, I'll get that out of ordered, but we can't do that until after you sign this consent, okay?
Okay.
All right.
Alright.
So let me know if anything changes.
Okay. Okay, and I'll be right back to give you your Ativan, okay?
Okay.
Okay, before she gives you the Ativan, we're just going to mark the site. Have you lean forward. Nurse Lisa. L3, L4.
Okay.
Okay? All right, I'll be back.
Okay.
Okay, and can you tell me your name and date of birth?
Maggie Lauer, May 25th, 1971.
Okay. And have you had Ativan before?
I don't think so.
No?
Oh, here, hold my hand.
And no allergies?
No.
No allergies, okay.
I'm so nervous.
It'll be okay.
It's
That doctor
in.
sounded pretty good.
And someone will
Okay.
be down to take you down in a couple minutes, okay?
Okay.
Alright.
What is a laminectomy? A laminectomy is when a surgeon removes the lamina of a patient's spine so that more space is created. Creating space alleviates pressure on the spinal cord and nerves. Pressure may be caused by bone overgrowth due to osteoarthritis or disc herniation. Disc herniation occurs when the disc portion of a patient's spine bulges or tears and causes pressure on the spine. Why a laminectomy? Pressure on the spine causes pain, weakness, and numbness that work as a debilitating triad. The pain radiates from the spine, affecting the arms or legs, possibly both, making the performance of ADLs difficult and unsafe. A laminectomy is attempted once conservative measures such as medication and physical therapy are proven ineffective. During surgery, the patient is put under general anesthesia and placed in a prone position. The surgeon cuts past the patient's lumbar muscles and exposes the patient's spine. However, the level of invasion depends on the severity of the patient's disc herniation. The surgeon removes portions of the herniated disc and any bony overgrowths and then sutures or staples the incision. Post-operatively, the patient may go home the day of surgery if they can void and walk independently. Otherwise, they stay in the hospital until they can ambulate and void independently.
Hi, Jackie.
Oh, hi.
All right, so here we have Maggie Lauer. She's 47 years old. She's a full code. She had a laminectomy on the L3, L4 due to herniated disc under general anesthesia. The surgery went well with no complications. The blood loss was about 300. She has 0.9 normal saline, running at 100 milliliters an hour through an 18 gauge peripheral IV in her left AC. No prior surgeries or history of chronic illnesses. She has no allergies. She's alert and oriented ×4. She's still a little groggy from anesthesia. She's weak with a back pain at 9 on a scale of 0 to 10 with a slight headache.
Oh, okay.
Vitals were okay. Temp was 99.1, BP 128/84, pulse is 82, respiration's 18, and her O2 is 93%. She has 1 liter of O2 going through her nasal cannula. And her labs were hemoglobin 10, hematocrit 30, and others were all normal.
Okay.
She has a dressing over the surgical site, 2 inches approximately with the stitches on her middle back. It's clean, dry, and intact. She has 5 milligrams of morphine IV push ordered for pain, Q4. She is to remain flat and to prevent that spinal headache. And all patient valuables are with her sister.
Okay. So, this was a patient of Dr. Wardle, correct?
Yes.
Okay.
Yes, that is correct.
Make sure of that. And then I just gotta watch out for that little headache she has going on.
Yeah.
So.
Yeah.
Alrighty. Well, thank
Alright,
you.
thank you.
Have a good rest of your
Thanks,
day.
you too.
Hello.
Hello.
My name's Jackie. I'm gonna be your nurse today. I'm gonna go ahead and grab some vital signs.
Okay.
She seems like kind of confused and like really tired. Is that like normal or?
See this one? Coming out of surgery, they're usually still a little groggy, and
Oh, okay.
I'll look her over, and if I find anything funky, I'll let the doctor know.
Okay, good. Thank you.
Just gotta take your temperature too, okay?
Mhm.
Under the 10.
Okay.
Okay. The temperature is a little high, 100.1. I'll have to check
Oh, okay.
orders and see if there's anything for that.
Do you know why it's high or?
Again, that might just be related to the surgery.
Oh, okay.
I'm gonna go ahead. Can you tell me your name?
Maggie.
Maggie? Do you know where you're at?
I'm assuming the hospital.
Okay, okay. Do you know what we did today? No. Do you know who the president is?
Bush.
Okay, okay.
Yeah, that's not normal. Yeah.
I'm gonna take a look at your eyes here, okay? Are you able to squeeze my hands? Go ahead, squeeze. Okay, okay. I'm gonna take a listen now, okay?
My head hurts. Like really bad.
Hurts?
Yeah.
How would you rate that pain?
A 10.
A 10?
Yeah. Like
Um,
really bad.
What does it feel like?
It just hurts.
Hurts. How long has it been happening?
Pretty much like when you got.
When I got up to go, I was gonna get up to
Yeah.
go to the bathroom, so I sat up a little bit.
Yeah, and then she started.
It hurt so bad I had to lay back down.
Okay. Okay. Usually when you do sit up after spinal surgery, that will happen.
Oh.
If it
Oh, I forgot.
if
I'm
it continues
sorry.
to happen though, and it's not, and it doesn't get better,
Yeah.
we're gonna have to let the doctor know. But she does have some pain meds, so I'll be able to go check that out. Okay.
Okay, great.
Can you give me a deep breath? Deep breath. Now listen to your heart. And belly. that all sounds good, okay? I'm gonna go ahead and take a peek at your feet here. I'm gonna check your pulses down here. Okay, can you push up? Push down? Oh, okay. Let me just see your fingers here. Check your pulses.
Does everything look okay or what?
Yeah, her blood pressure's a little low.
Oh,
Okay. And it looks like her oxygen saturation's also a little low, so we're gonna go ahead and bump up her O2.
Oh, okay.
And then I'm just gonna have to take a look at the at your back.
Okay.
Okay, see how that incision is looking. Are you able to roll towards your sister? Easy, good. Just gonna peel this back a little. Okay.
How does it look?
There's a little drainage.
Is that okay?
I'm actually gonna go grab some strips and test to see exactly what that drainage is.
What would it be?
There's a chance that it could be. You can go ahead and lay back on down. There's a chance that it could be cerebral spinal fluid, but the strips will let us know, and then we'll
Oh,
go from
okay.
there. Okay.
All right.
Okay. So I'll be right
And then
back.
the doctor will come in and
Yeah.
look at her. And,
If
okay.
if anything's abnormal,
Okay,
she'll
good.
come back. Okay. Hello, Dr. Wardle. This is Jackie. I'm on the nurse on the med-surg floor with your patient Maggie Lauer. She's a 47-year-old female, post-op day 1. She had a laminectomy yesterday. She's complaining of a really bad headache. On a scale of 10, she's a 10. Her vital signs: blood pressure's 104/60, heart rate's 100, respiration's 20. Her O2 was 89%, but I bumped her up to 2 liters of oxygen, and she's sitting at 93% now. And her temp is 100.4. When I checked the dressing on her back, it was pretty saturated with serous sanguineous fluid, and it leaked onto the bed sheets also. There's also a yellow tinge to it, so I went ahead and tested it with the glucose strips, and it was positive.
Okay, I'm gonna have you bump up her oxygen to 4 liters. I want you to give her a 500 cc bolus of fluids. Make sure that her antibiotics are started, and I'll be in the way. Please don't medicate her till I get there. I want to see how this headache is when I get there, okay?
Okay, so 4 liters of oxygen, 500 cc bolus, and start her antibiotics.
Yep, and I'll be there when I get there.
Okay, thank you.
Cerebral spinal fluid leak complication. If the patient is having a cerebral spinal fluid leak, the nurse will lay the patient flat, increase fluids, and call the surgeon to obtain an order for an MRI to confirm a leak. Once a leak is confirmed, the surgeon may order an epidural blood patch or fibrin glue to be applied to the spine. In some cases, nurses are ordered to increase fluids, keep the patient flat, and wait it out. Signs and symptoms of a cerebral spinal fluid leak include clear fluid leaking from the incision site, orthostatic headache, cognitive decline, vision and hearing changes, nausea, and numbness.
Hello again, ladies.
Hey, she's still kind of, she's not acting herself. She's still kind of confused. So I'm like kind of getting concerned. You know what I mean?
Yeah, I understand. That's why I
So-
came in. The nurse called and she said that she had a real bad headache. Is that true, Maggie? Do you have a headache? Yeah? Is it better now that you've been laying down? No? Okay, let me call the nurse in here. Let's see if she answers.
Can I help you guys?
Oh, yes, it's me. I need help. We're gonna roll her and I'm gonna look at her dressing.
Oh,
I'm gonna look at your back. I see she's got the antibiotics
I'm gonna
going
sneak in
to
there real
prevent
quick.
the infection from happening, okay? And I'm gonna look at it and I'm gonna see,
Okay.
she mentioned that there was some drainage, a little bit more than what we're expecting.
Mhm.
If it's what I think it is, it sounds like we might need to do a blood patch.
Oh wow, what's that?
It's a procedure where you take her own blood and seal the hole that's in her spinal cord from the surgery that might not have healed, which is what's giving her, it's called a spinal headache.
Oh.
And those can be very painful, which is
Yeah.
why usually they get a little bit better with lying down, but we try and keep people flat for as long as possible after surgery to
Yeah,
prevent
she
this.
did try to sit up. I
Yeah.
told her not to, but.
Yeah, that's usually what happens. So I'm gonna have you raise the nurse. Oh, thank you, nurse. So I'm gonna check, and if that's the case, we can do this right at the bedside. I'll be able to medicate her after I look. She won't feel a thing. It should be very.
Oh, and then she'll feel better?
Yes, and she should
Okay,
feel better
good.
almost instantly. Okay.
Okay.
All right. You're gonna roll this way.
All right, Maggie, roll towards me. I'll help.
What's it look like?
Are you squeamish with blood?
Yes, so
Okay.
I'll just stay back
Stay
here.
back. Okay. It just looks like there's some red blood-like drainage, and then there's also seems to be a yellow drainage, which is common when you see cerebral spinal fluid leaking, which is what I
Oh.
think it is.
Okay.
So I'll be right back. I'm gonna have the nurse prep for a blood patch, and
And
we'll
then
be able
that'll
to do
fix
this.
it?
And yeah, she should feel
Okay.
better
Go ahead, roll back.
instantly.
Okay.
Really. It
Oh,
should be very
good.
fast. Yes. Okay. Do you have any questions for me?
I think you covered it all.
Okay.
I just wanted to feel better.
I understand. All right. Hello again, Miss Lauer.
Hi.
How are you feeling today?
Better, a lot better.
Yeah, she's so much better.
Oh, great.
Yeah.
Okay. Well, I'm doing my rounds. I'm going to have Nurse Jackie tell me how you've been doing. So this is what we call bedside report. So if there's anything that you need to add or feel like is incorrect, please let me know while we go through this, okay?
Okay, so today her vital signs have been all normal throughout the day. We were able to get her off the oxygen last night, so she hasn't been on it for a while. And we're not running any more antibiotics. All her antibiotics are done. We're just keeping her fluids running KVO just so we have a patent IV.
Okay, perfect. All right. So how has it been going with physical therapy? Have you been doing better?
Yeah, it's been going
Okay.
pretty well.
All right, because here's my plan. I think that this afternoon I should be able to get you out of here. So if that's okay with you, if you feel comfortable going home, we're gonna.
Am I gonna do therapy after?
Yeah, actually, I'm gonna have Nurse Jackie go over this with you, but you're gonna go through physical therapy for a while, and you know, I'm gonna give you some antibiotics to take at home, just because you were getting those IV antibiotics, and some pain medications for at home as well. But I'm just going to give you a 7-day supply of those pain medications just because of the opioid crisis. So I'll see you again in my office in 3 days after you're discharged. So that'll be Tuesday, I believe.
Okay.
And then you know, you'll just keep going to physical therapy. I'll double check, but your site looks good. Everything looks good. It doesn't look like you have any kind of infection or anything like that. Okay.
Yep.
Any questions?
No, that's.
When can I go back to work?
Oh, yeah, that, yeah.
So work is going to have to wait a while. We'll talk about it more when you come back to my office after you've been at home. So we'll get a plan. But as of right now, I can have Nurse Jackie make sure that you have an updated note for your work so they understand, you know, that you had the surgery but you're not ready to come back to work yet.
Okay.
You got to finish that physical therapy first, all right?
Okay.
All right, well, it's great to meet you.
Thank you.
Great to meet you. Let me know if you have any questions. You can call my office if anything comes up before your next appointment, okay?
Okay.
All right, have a good day.
Okay, Maggie, so once the doctor writes up the discharge papers, I'll be back in and we'll get you going, okay? If you need anything between then and now, just hit your button. I'll be back.
Okay.
Okay?
Okay,
Alright.
thanks.
Yep.
Get to go home.
Yay.
Discharge teaching. Medications, analgesics, muscle relaxants, and antibiotics. No driving, bending, housework, or lifting anything greater than 10 pounds for 2 to 3 weeks after surgery. Wait 6 weeks to have sexual relations or exercise at the gym. Returning to work depends on the type of job. Office work may be resumed on the patient's discretion. To be noted, there are no diet or shower restrictions post-operatively. Some patients may require braces or other assistive devices, and that will require further teaching. All patients are encouraged to call the doctor should the following occur: a temperature of 101.5, increased wound drainage or numbness and or loss of strength.
And then on that day, she'll let you know about work better, okay? And
Are you
Hey!
serious?
Are you serious?
excuse me.
Excuse us. Like, really?
Oh my god.
What the hell? Alright.
We were almost done.
Guys.
Like, literally.
Oh my god.
You gotta talk louder. You can't whisper.
out. Okay, ready? Okay, action.
Are you nervous? How are you feeling?
Stephanie, you have to speak louder. Okay, ready?
Really loud.
Ready, go.
How are you feeling?
Okay, ready? Okay.
You don't laugh every time.
Ready?
I'm sorry. Let's go.
I met Lisa earlier, but my name is Dr. Stethoscope. I'm going to be the surgeon today.
Very
She just went all over.
Okay, so I'm just gonna have air.
Okay, that's fine.
No, just okay. And this was a work-related accident?
Yeah.
What is so funny?
Ah.
You're editing it in from here on.
Okay, keep going.
Lisa,
keep going.
bend
Roll.
over, hold hands, act the exact same.
Thank you.
Okay.